Hello, this is Ford Brewer. Today we're going to talk about Lyme disease. Again, this is a channel on heart attack, stroke, disability prevention. So why would there be a video on Lyme disease? Well, first of all, if you're not familiar with the fact that Lyme disease can cause stroke-related symptoms or disability very much associated with stroke, then you're missing the majority of the serious part with Lyme disease. Lyme disease can also cause your heart to stop as well. This is a newsletter from the Harvard Health Publications, Taking Lyme Disease to Heart. It's talking about an unusual complication, but it does happen. People have died sudden cardiac death due to Lyme disease because a couple of different ways. The one mentioned in this Harvard newsletter was infecting and destroying some of the conduction tissue of the heart. If you do a Google search on vascular inflammation and Lyme disease, you'll just see a ton of research associated with the area. So yes, very similar components. It's not the long-term inflammation that we've been talking about on many videos in this channel, but it's much more of a short-term, quicker inflammation, and it can be long-term if it's not treated. To the point about heart impact with Lyme disease, this research was done on pancarditis. In other words, the infection was in more than just the conduction tissue of the heart. It was throughout the heart tissue. So yes, it can even cause heart attack. Not a myocardial infarction, but same result. It can cause sudden death. It can cause other cardiac disability as well. Now, most of you that are aware of the disabilities associated with Lyme disease are really more aware of stroke. And it's very interesting. You can see this patient has some of the neurologic diseases with stroke-like symptoms. A loss of the balance or the mirror image of the face. She's got drooping on this side and loss of what's called the nasolabial fold. Another one of those medical terms that may be intimidated until you stand up to it and push back. Simply, naso means nose and labial means lips. So she's getting some loss of her nasolabial fold, which is due to loss of brain and nerve tissue innervating these muscles, which create these landmarks on the face. This, by the way, is the offending organism. It is a spirochete. For those of you who are interested in medical history, this is not the first spirochete that's caused significant damage with the U.S. population. In fact, prior to the antibiotic era, there was an epidemic of a spirochete-related illness. That spirochete was Treponema pallidum, syphilis. It was known by physicians as the great imitator because it could cause stroke-like issues. It could cause heart problems. It caused several other things, including rash. Speaking of rash, there is a classic rash for Lyme disease. And just by the way, this got really personal for me. Last week I was standing at my computer workstation doing research for one of these videos. I felt this itching and burning in my back. I'd had that before in the past because I had a skin cyst back here. But then it occurred to me, I haven't had the skin cyst in over 5 years. It was removed at a time when I had a cancer back here. So my wife took a look at it, and right in the middle there was a tick. She removed it, and I thought nothing more of it except that I was irritated about having the tick there. You see, we live in an area where I actually have pictures of whole flocks of turkey in our front yard. Now that's nice, it's fun, until you realize and remember that wild birds are actually one of the major sources of ticks. We're not so much in a rural area, but it's a subdivision that's been built over the past few years on a mountaintop. It's beautiful, we love it, but we still have, and again, we get beautiful things like flocks of turkey, but we also get ticks too. This is not my first tick bite since we moved here. Anyway, this picture was taken 2 days later. I had a rash that was moving out from that area where the tick bite was. That rash, it's a fairly classic rash. It's called erythema migrans. Erythema means redness of the skin, simply. Migrans means that it's moving. So that's classically what happens with Lyme disease. 3 days later, it had continued to move out to a much larger area. So I clearly had erythema migrans. I had a tick bite. Let me just digress from my own personal case for a minute and talk a little bit more about erythema migrans. You may have heard of the target lesion associated, the classic target lesion associated with Lyme disease. That's what these are, and you see what happens. You get that redness or erythema. It's migrating slowly outwards, and you can get episodes of less erythema and more erythema. That is what causes that classic target lesion of Lyme disease. I actually, when you look deeper at mine, I can't show it because of the images that I have, but there was a little bit of a subtle target lesion perspective as well. So it may sound like I'm getting really worried about Lyme disease for myself, and actually I never was, and here's why. First I'll show you the tick that causes it. This is called a black-legged or deer tick. Black-legged tick, Ixodes. And here's a dime for comparison. So you see these are small ticks, and usually most disease is caused by the nymph because these smaller ticks are able to crawl around without being noticed and place that bite. Remember I said I wasn't ever too worried about it being Lyme disease? Here's why. These black dots all represent cases of reported diagnosed Lyme disease in 2014. And as you can see, this is a disease mostly of the northeast. And if you look at it, I live in Nashville, Tennessee. There have actually been a few cases reported here, but not very many. There was another reason that I haven't been that concerned about Lyme disease itself. That had to do with the tick and the tick bite itself. And I'll tell you that in just a minute. I felt the tick bite, and that, feeling the tick bite and being located in the southeast area of the country is, and then especially having erythema migrans, that is far more classic for a far more common type of tick bite in my part of the country. It's called STARI, or Syndrome of Tick-Associated Rash Illness, STARI. There's some double meaning to that because it's caused by the Longstar tick. That tick is not called the Longstar tick because of any association with Texas. As you can see here, there is a lone star on the back of this tick. Now, you may not always see it because, again, as with most ticks, most of these bites are actually caused by the nymph, the smaller version of the tick. Here's a picture of the male and female out in the wild. So there's a lot of things to learn about this. Number one, there are actually infectious causes of heart attack and stroke. And when you think about it, this is not the major one. The major infectious cause of heart attack and stroke does appear to be gum disease. The couple of major points about it, and we've had a couple of videos on it. We'll need to have more. By the time we're 30 years or older, up to half of us have gum inflammation. That inflammation is usually associated with significant infection. There's a half dozen specific bacteria that tend to be associated with that gum disease. And in fact, as you get deeper into the microbiology and the metabolic analysis of what's going on, it does appear that the bacteria or the infection is what's causing that long-term inflammation. We know right now our estimate regarding population-wide and the cause of heart attacks and strokes, right now we think 70%, maybe more, is associated with insulin resistance, which happens with the type 2 insulin resistance happens 50% of us by age 60. Now, what we don't know is how many heart attacks and strokes are being caused by inflammation from gum disease. Lyme disease is very interesting, and for those of us who get into this kind of stuff, it's a lot of fun to ask questions about it. But the real issues here, the real things causing early death in our population are, number one, diabetes, and number two, gum disease. We just don't know right now how much of this problem is being caused by gum disease. That remains to be seen.